There is no learning without a sense of agitation and focus. It actually requires us a little bit of that leaning forward in the chair. Focus and agitation and alertness, they work together, because when acetylcholine and epinephrine are liberated in the brain and body together, it basically signals to the nervous system, okay, I need to rewire things so that I don't have to deploy all these resources in the future.
So you're speaking really about, how do we play with our brains in a different way than we thought about? And you talk about this idea of neuroplasticity, which I'd like to sort of jump into a little bit. The brain, what I learned in medical school was that you were born with a certain number of brain cells, and that's all you get. And if you used up too many in college by staying up all night or doing drugs or partying too hard, well, tough. That's all you got. But it turns out that's just not true.
That's not true.
That we have tremendous ability to restore brain function, to bring back, all sorts of things at any age that we just didn't think possible. I mean, I just had a patient who, was a 70-ish-year-old guy who had a stroke and was paralyzed on one side. And, traditional care is like, just do rehab and take your blood thinners and cross your fingers and, hope for the best. And I'm like, hell no. We know a lot about how to optimize brain function. So I put him on a ketogenic diet, which helps the brain repair and heal. I had him do hyperbaric oxygen therapy. I had him do IV nutritional therapies like NAD, which helps the tissues and cells in the brain repair. It helps the energy cycle. I had him take a number of supplements that help with inflammation, mitochondria. And I had him do exercise, a whole cocktail of things, because it's not any one thing that's going to make a difference. Right. Even had him do sort of derivatives of stem cells and things like exosomes. And it's unbelievable to see how much he's been able to recover and repair from what we would have thought in medical school, when I was going to medical school, was a permanent disability. And now he's not disabled. He's walking, he's using his body, he's doing things, he's come back. He's not 100% yet, but it just, compared to what we imagined was possible, we're seeing things we never thought possible, like whether it's reversing Alzheimer's or autism, strokes, trauma, brain trauma, even things like depression, anxiety, PTSD. We're seeing all sorts of doorways into repairing that. The psychedelic therapies that are being used now, or MDMA therapies for trauma and for PTSD, are changing the way we think about accessing the brain. It's like, how does that even make sense that you take, one therapy of psilocybin and all of a sudden lifelong symptoms are gone of depression?
It's wild, right?
It's pretty wild, because we just like, you need 30 years of therapy and psychoanalysis 5 times a week, and nope, just go on this 7-hour journey with a therapist and a guided experience, and something shifts in your brain.
The data coming out of Hopkins are really impressive. I think we're going to look back at the work of Matthew Johnson and some of the other groups in the UK and the MAPS groups. And I know less about the MAPS groups, and I think we're going to realize that, they are true pioneers. And it's a topic for another discussion perhaps, but what they've had to go through in order to bring credibility to this area has been really incredible. So neuroplasticity is real. The brain's ability to change itself in response to experience, for better or for worse. I think that most of the discussion about plasticity is going to be what I call we don't have to get too much lingo, but adaptive plasticity is the stuff we want. And plasticity after a head injury or from chronic illness is the kind of plasticity we don't want. No. But if we say plasticity, it's almost always neuroplasticity of the type we want. I think that the way to think about neuroplasticity is that early in life, our brain is extremely plastic. Our brain is basically designed to wire itself up from about birth until age 25, which is not to say we don't need guidance from parents and peers, et cetera, but that the brain is trying to create a map of its experience so that it can move forward from that point. There are areas of the brain that are not very plastic, and we should all be grateful for that. Areas like the areas of the brain that control your heartbeat, your respiration, to make sure your gut continues to churn food along, like, all the kind of basic stuff, the housekeeping stuff. But the rest of it we're discovering is extremely plastic. And from age 0 until age 25, just mere passive experience, exposure to things, your brain will change, creates a map, for better or for worse. Now, if people have traumas in that time,
conditioning,
or conditioning, there are ways to undo that. And that all starts usually around age 25, people, maybe earlier, but the skills you learn, how to walk, et cetera, all that's laid down early in life. But from 25 on, I want to draw a distinction, because from 25 on or so until the end of life, the brain is still very plastic, but the requirements for changing the brain shift radically.
Yeah, talk about that.
Yeah, so the way to think about this is that the adult brain has no reason to change unless it has a shift internally that says what you're about to experience or what you just experienced is meaningful enough that you got to do something, you got to change.
Yeah.
Okay. Now, the negative stuff always provides the most salient examples of like a car crash. You'll never forget that. Where I was when when I first learned about 9/11, when the shuttle exploded. One trial learning, immediate brain change is always going to happen for negative events more readily than it is for positive events. I'm sorry, that's just the way we're wired. There's an asymmetry there. Yeah. It's designed to keep us safe,
out of danger,
keep us out of danger. And we should be grateful for that. So, but adding new skills, changing our emotionality, even changing personality, it seems to some degree, can be accomplished if certain chemicals are liberated into the brain and or body. And the chemicals that cue the nervous system, I need to change something, basically fall into two categories. And they are adrenaline, epinephrine, and acetylcholine. So acetylcholine, we could start with that. Acetylcholine is released from multiple sites within the brain. It's actually the neurotransmitter that allows us it's responsible for nerve-muscle communication.
Memory, too.
Memory. There are two main sites in the brain that release acetylcholine. One is in the back of the brain, in the brain stem, and it triggers alertness. And it also acts as sort of a spotlight on certain areas of the brain, saying, whatever's active right now, I'm going to mark that for change later. I'm going to make those connections stronger. It's just the nature of it's sort of like a sprinkler system. It's more general. But it's kind of in the vicinity of I want to learn, you mentioned that you learn Chinese. So let's say I don't speak any second language really. So let's say I wanted to learn Mandarin. So if I were to go in and try and learn Mandarin, it'd be very, very challenging for me. So I need to focus. We know that early in life you can assimilate new knowledge without having to focus too much.
Yeah, which is amazing.
But that's because the whole brain is basically bathing in acetylcholine. Yeah. It's
like I see little kids.
Youth is lost on the young.
Like 3 or 4-year-old kids speaking 3 languages. I'm like, what the heck?
Exactly. So younger people always ask me, what should I do if I'm not 25-year-old? Here's what you should do. Don't even check with your parents. Learn a second or third language. You'll thank me later. Learn a musical instrument. You'll thank me later for many reasons. I didn't do either of these two things, by the way. And develop good habits around health and nutrition and learning. And you're pretty much home free.
Okay.
So those are the things that you're good. And you have this gift of plasticity. It's just, et cetera. So as an adult, you need acetylcholine released also from this area of the forebrain called Nucleus Basalis. There's a collection of neurons in the basal forebrain that when those become activated, essentially anything that you experience in the time window around that can be rewired. And these are incredible experiments that were done by Mike Merzenich at UCSF and colleagues, where they would stimulate Nucleus Basalis and then provide some sensory experience, and the brain would just remap within seconds. Now, the problem is getting Basalis to release acetylcholine is challenging.
How do we do that?
Yeah, so it comes from powers of focus. You have to be able to contract your visual window or your auditory window, whatever your attentional window is. You have to be able to bring a lot of focus to that learning event or life event. And now if you think about negative life events, you can realize why we learn them so readily, because they bring about our entire focus, right? I'll never forget seeing those planes hit the towers in New York. So I wasn't focused on anything else. I can see it in my mind's eye now still. Right. And I probably don't have all the details right, but that's the level of focus you need to bring to something that you want to learn as an adult. Now, there are things that can facilitate, as we call it, cholinergic transmission. First of all, there needs to be a baseline level of alertness. And that level of alertness is going to come from epinephrine, from adrenaline. So there is no learning without a sense of agitation and focus. I think most people think, oh, I'm just going to calmly go into this and I'm going to learn Mandarin or whatever. No, it actually requires us a little bit of that leaning forward in the chair. Now your agitation and your your knee bumping, Mark, makes sense because you were that guy and you're rich with knowledge, you know.
So that's why so well medical schools always
that's epinephrine. That's epinephrine. That's epinephrine. And so you set the stage for that by getting good sleep and by being excited and motivated. You know, the phenomenon of meeting someone and then you forget their name a second later, you were focused on something else. We all do it. I'm terrible about that too. But when you meet somebody that you're very interested in, let's be honest, you don't forget their name.
No.
It just locks in and you never forget. You never forget the details. Mm-hmm. And so focus and agitation and alertness, they work together because when acetylcholine and epinephrine are liberated in the brain and body together, it basically signals to the nervous system, okay, I need to rewire things so that I don't have to deploy all these resources in the future.
So if we want to improve our brain function, improve our learning, our memory, our alertness, attention, that's what people care about. And we want to enhance the neuroplasticity. What are the top things that we should be doing?
Okay, so get the foundational stuff right.
Sleep.
Sleep, get your nutrition right. And there are many things, and you speak to this in much more detail and sophistication than I ever could. But I think that you said, I think the omega, what do you say?
Follow the Pegan diet. I jokingly call it.
Not vegan. Okay.
No, not Pegan.
Yeah.
No, not vegan.
Yeah. So follow. Get sleep right. Get your nutrition right. Get your relationship to stress right. We can talk about that maybe at the end. But basically, you need cholinergic transmission, and the thing you need sufficient choline available, and we know that choline is going to come meat sources,
liver,
nut sources. Now, eggs, certain fish,
sardines.
So you need choline available. Now, you can't just ingest those things and expect to get smarter. People always say, tell me what to eat to get smarter.
Now, sardines, you're going to get a long way.
You have to engage in those focused learning.
You might have any friends because you have bad breath, but otherwise.
You have to engage in those focused learning bouts. You have to decide what it is that you want to learn, what you want to change, and do that. Now, for some people, they'd say, well, I don't want to learn another language. I just want to feel happier. But that's actually, as we know, a process as well. That's going to be a process of leaning into some gratitude practice or some, maybe if what makes you happy is a physical activity, it's going to be bringing the greatest amount of attention and alertness to that practice as you possibly can. And there's a lot of literature now pointing to the fact that what we sometimes call flow or flow states or getting lost in the beauty of some experience or often involves a bit of challenge. It involves a sense of focus, and your focus will drift, and continually bringing that back. Now, from a supplementation side, the data on Alpha-GPC are pretty impressive to my mind.
That's glycerophosphocholene, which is a derivative of choline for people listening. Yeah.
You know, people, I mean, again, I'm not a physician, so I can't prescribe anything. But the data on anywhere from 300 to 900 milligrams of alpha-GPC before a learning bout, it's clear that cognitive function goes up. It's clear that people remember more. It's clear that people retain more of that information. So there's the encoding part, which is the part in which you're packing in the new knowledge, and that requires high levels of alertness and focus. And that's going to be supported by this nutritional, perhaps supplementation background. And then there's a second step. And the second step is the one that in recent years we've learned the most about, which is that just having this heightened level of focus and attention to what you're trying to learn or change is just the first step. The second thing is to actually turn off focus and put the brain into a state where it can rewire more rapidly. And there's a beautiful study that was published in Cell Reports, there's a fine journal, last year, showing that if people go into a kind of a pseudo-nap, or they intentionally move away from any kind of focus for 20 minutes or so after an intense learning bout, that the brain rewires more quickly, and their heightened levels of retention. The brain just rewires in these states of relaxation. So it's just sort of like physical fitness. You don't actually get better during the effort. You get better during the recovery.
That must be why I did so good in neuroscience, because I was reading that Kendall book, and I remember being in the library in medical school, and I would look like a reader, and I would like go, and I would like put my head on the book.
Exactly. And then wake up and keep reading.
Oh, okay.
That book is a beast. No disrespect to Eric, because I think that's a beautiful book, but there's now a shorter one.
If you love that last video, you're going to love the next one. Check it out here.